Hello, everyone. This is Dr. Kelly. Welcome to my Facebook show. So when you come on, please please share the video. Please let me know who you are when you join me so I can say hello. So today I'm discussing a hard topic: low testosterone and erectile dysfunction. And I'll tell you the inspiration behind this discussion today. So 2 weeks ago, I was visiting my brother, and we had Dr. Cindy on, and she talked about infertility and gave us ladies, options to preserve our fertility. And my brother said, you always have these discussions for women, but what about the men? And with June being Men's Health Awareness Month and tomorrow being Father's Day, I thought it'd be a good idea to talk about low testosterone and erectile dysfunction. So when you come on, please please share. Ladies, bring your husbands, bring your boyfriends, bring the side boos, bring everybody to this discussion. So what is erectile dysfunction? So erectile dysfunction is the ability to get and keep an erection firm enough to have sex. So it could be associated with low sex drive, also called low libido. It can also be associated with difficulty in getting an orgasm, or difficulty climaxing. And, a lot of people are really afraid and ashamed to even bring this up to their physicians. We don't talk about it. Like no one, I don't know. I'm not sure if men go around talking about their erectile dysfunction with each other, but this is kind of a taboo topic, but it really shouldn't be because it's extremely common. So I saw some stats that said, it's actually normal in up to 20% of sexual encounters to have some type of erectile dysfunction. Let me say that again. It's actually normal in up to 20% of sexual encounters to have some type of erectile dysfunction. However, you should seek medical attention if it's happening more than 50% of the time. And just how common is erectile dysfunction? So if you are around the age of 40, it's complete erectile dysfunction happens in about 5% of men. And as you get older, the rates increase. So at the age of 70, about 15% of men have complete erectile dysfunction. What about mild and moderate erectile dysfunction? It's 10% per decade. For example, in your 50s, the rate is about 50%. In your 60s, the rate goes up to 60%. So what are the causes of erectile dysfunction? So male sexual arousal is a complex process. It involves your brain, your emotions, your hormones, such as testosterone, your nerves, your muscles, and blood vessels. So a good way to kind of categorize erectile dysfunction is 1, physical cause, and 2, psychological cause. Like men need to be in a state too, right? You need to be in a right frame of mind to be able to have sex. So physical causes would be stuff like heart disease, diabetes. I'm an endocrinologist, so I treat patients who have diabetes. And a lot of men come in with the complication of diabetes being erectile dysfunction. And as physicians, we also need to ask these questions more often. So heart disease, diabetes, hypertension, obesity, sleep apnea. If you have a low testosterone, that accounts for about 3% of cases of patients who have erectile dysfunction. So most people who have erectile dysfunction will not have a low testosterone. Alcoholism, smoking, drugs, medications that your doctor might prescribe for high blood pressure. If you have depression, antidepressants will also lead to erectile dysfunction. So those are the physical causes. Just going to share this video so that more people can see it. While I do that, you guys do it too. Please share the video. And then after that, I will go on to the psychological causes. So in terms of psychological causes, things like depression, anxiety, stress, relationship problems, communication problems. If you have stress at your job, anything that can stress you out can lead to erectile dysfunction. But it could also be a combination of both. So if a man has a medical condition such as diabetes or heart disease, and that leads to erectile dysfunction, the stress that causes in a relationship would lead to more erectile dysfunction. So those are basically the physical causes as well as the psychological causes. So when a man comes in to see me for low testosterone issues and erectile dysfunction, I always ask them, is everything going well at home? Are you having any issues in your relationships? Is there any stress that's going on your job? Like other things besides a medical condition can lead to erectile dysfunction. But I wanted to spend most of our discussion today talking about low testosterone, because as a hormone specialist, that's what a lot of men come to me for. So in men, the testes are responsible for making sperm and testosterone. So the symptoms of low testosterone include low sex drive, low libido, difficulty getting and maintaining an erection. Men can also complain of a reduction in mood. They feel depressed. They have difficulty concentrating, loss of lean body mass. And low testosterone is also a cause of infertility. So we talked about infertility about 2 weeks ago. And just to reiterate, it's not always the woman. Most of the time, it's both the male and female partner might have some issues that would need to be addressed before they could get pregnant. And low testosterone is one issue that can occur in men that can lead to infertility. And if your low testosterone persists for a very long time, it can also affect your bones. It can lead to osteoporosis. Dr. Renee, you asked me, where's the video? What video did you mean? So thank you guys for logging on. I see Dr. Renee is here. I see Celia is here as well. Like I said earlier, when you come on, please please share the video, please say hello to me. So as men age, testosterone levels naturally decline. So someone in their 70s is not going to have the same testosterone level as someone who's in their 20s or 30s. And when we check for testosterone levels in the lab, the range goes from something like 250 to all the way up to 750, because it's given the range for the whole population. So like I said, if you are 70 years old, your number will probably be closer to 250. So just like women go through menopause, men go through andropause, where testosterone levels naturally go down. So it's actually normal for men to have erectile dysfunction as you get older. But the issue comes around, arise when that decline in sexual function happens prematurely. So if a man comes to me with symptoms of erectile dysfunction and I check their testosterone and their testosterone is low, the next thing that I have to do is to figure out if it's a primary problem. And when we talk about primary testicular failure, meaning that there's a problem with their testes. Or if it's a secondary problem, meaning it's a problem with the pituitary gland. So the pituitary gland is a gland that sits in the base of the brain, and we can consider it to be the master hormonal control gland. It controls the thyroid, it controls the ovaries, it controls the testes, it controls the adrenal gland. So the pituitary gland is super important. So when someone has a low testosterone level, first thing I have to do is see if it's the testicular problem or if it's the pituitary problem. I want to say good morning, good afternoon to those of you watching me from blackdoctor.org. Thank you for joining in. Please type your questions in and I will be sure to come back and answer them. So what are the causes of primary testicular problem? Age, like I said earlier, if you had an infection, a lot of us, mumps has kind of been eradicated because of the advent of vaccines. But in the past, men could have an infection of their testes by mumps. We call that mumps orchiditis, and that can lead to low testosterone. Cancer treatment, a lot of men who get other types of cancer and get chemotherapy. Chemotherapy is a common cause of infertility. That's why a lot of men, before they embark on cancer treatment, especially if they desire to have more children, they can give a sperm sample. They bank their sperm. So like with women as well too, if a woman is going to have chemotherapy, a discussion that should be had before that is, do you want to freeze your eggs if you want to have children after that? And then the last thing is undescended testes. What about pituitary problems? This is an interesting one. So we can have small tumors on the pituitary gland that prevent our pituitary from making the hormones that stimulate the testes. So that leads to low testosterone. The pituitary is also infected if you are on medications such as narcotics. So a lot of people who have like chronic back pain, or maybe had a work injury, or were involved in a motor vehicle accident and have like back issues, they might take, Percocet or oxycodone or morphine. And these medicines shut down the pituitary gland. So the pituitary can't stimulate the testes. So that also leads to low testosterone. Obesity. This is a big one. Obesity also shuts down the pituitary production of hormones, leading to low testosterone. So I see a lot of men coming in to see me for low testosterone, and the vast majority of these men are either overweight or obese. And like I said just now, the pituitary hormones are actually affected by the extra weight. Also, all of these hormones that we know about, the thyroid hormone, testosterone, cortisol, estrogen, a lot of these hormones are existing in two states. The first state is that it's bound to protein, and the second state is that it's freely floating around. It's the freely floating hormone that actually interacts with our cells and causes our cells to do our bodily functions. So what we found is that men who are obese or overweight, they have high levels of insulin because they have insulin resistance. And this high levels of insulin actually reduces their amount of sex hormone binding globulin. This is the hormone that kind of binds testosterone. So what does that mean? That means that even though for an obese man, your total testosterone might be low, you're freely floating, and actually the more important testosterone might be normal. So if a man comes into me and they're obese, I always make sure that I check for those binding proteins as well. Also, do you know that both men and women have estrogen? So yes, men have estrogen. However, it's in a lower amount than women, and women, we also have testosterone, but a lot lower amounts than what a man has. So estrogen is actually testosterone is actually converted to estrogen in fat cells. So if you have more fat cells around, you're going to have more conversion of testosterone to estrogen. And that's another reason why, in general, men who are overweight or obese, they have low sex drive and low libido. But the good news is that if you can lose some weight, it has been shown that losing weight will naturally increase your testosterone levels. So if a man comes to me, the first thing I do is not to throw medication at them. I said, you know what? We can work on some lifestyle changes, some lifestyle modifications so that you can naturally raise your testosterone levels. So how do you prevent, erectile dysfunction and low testosterone? You're in your 30s, you're in your 40s. They say that, women, we come into our own in our late 30s, but by the time men reach 40s, it's kind of on the way down. But how do you prevent erectile dysfunction? One, if you smoke, quit smoking. Smoking actually restricts the blood vessels that go to the penis. And to get an erection, we have to have good blood supply. That's why diabetes does the same thing. Diabetes affects the vessels that go all over your body. It promotes atherosclerosis. So you have plaque buildup even to the vessels that supply the penis. That's why it's hard to get an erection when you have diabetes, especially uncontrolled diabetes. Diabetes also affects the nerves. And the nervous system is also important in the process of getting an erection. So if you have diabetes and you have erectile dysfunction, please talk to your doctor about it so that you guys can get you on a weight loss program, make sure that you are on the right medical regimen so that you can lower blood sugars and hopefully you can also reverse or improve your erectile function. So quit smoking, exercise, maintain a healthy weight and diet, limit or avoid alcohol use. I know you've heard about it, right? When a man drinks too much, sometimes it's difficult to perform. So limit or avoid alcohol use. Reduce your stress. This is a big one. If you have anxiety and depression, one way that it can show up in your life is in the bedroom. And as a Black community, we still have stigma attached to mental health, stigma attached to anxiety and depression, so we don't seek help. But it really affects all areas of our lives. And if you are stressed out in your relationship, if there are communication problems, if things are just not going well, one symptom of that root is erectile dysfunction. If you have stress on the job or financial stress, I know with the pandemic going on right now, a lot of us are under financial stress. And one way that might be showing up is in your bedroom. If you take drugs, stop harmful drugs. Those will also affect your erectile function, as well as, monitor your blood pressure, monitor your blood sugars and your cholesterol levels. Make sure that you still go to see your primary care physician. I know when COVID-19 first started, a lot of us were kind of staying at home because we were afraid to go into the hospital. And, I understand that fear. But right now, a lot of you might have missed your appointments over the last 3 months. I would suggest that you reschedule your appointments and go back in. A lot of physicians are still doing telehealth. They're still able to see you by video, or you can go in. But I think if you have diabetes or heart disease or hypertension and you've been staying away because of COVID-19, I would recommend that you go in for your appointment. So if you already have erectile dysfunction, what do you do? So there are a few options. So we've all heard about that little blue pill, Viagra, Cialis, Levitra. These are all medicines that we use to help with our erections. They could be used as needed, like 30 to 60 minutes before sexual intercourse, but that means that you're going to have some planning involved. You've seen the ads on television with the couples and, they're happy and he's talking about Viagra. So you can plan it that way, or you can even take these medicines on a daily basis so that you're always ready. So that's one option. And these medicines work by relaxing the blood vessels, relaxing the walls of the blood vessels that supply the penis so that they increase blood flow to the penis and aid in having an erection. Because these medicines relax the blood vessels, they do it all over your body, not just your penis. So what happens? It can lower blood pressure. So if you are already on a blood pressure lowering medicine, especially something called nitrates. We use nitrates in patients who have coronary artery disease or vasospasm, like spasm of their arteries, because they relax the vessels. If you combine Viagra and a nitrate, you're going to have a plummet in your blood pressure. So before you start anything, your doctor needs to go through your medication list to make sure there are no interactions. In terms of side effects of medicines like Viagra, some men complain of headaches, like just feel stuffy. Their head feels funny, as well as it can actually change your color vision. You read any textbook or you read it in package insert, it can actually change your color vision. So what about testosterone? This is what I do. So with any medicine, it could be Tylenol, it could be ibuprofen, any medicine that you can put into your body has side effects. And you have to weigh the benefits of a drug against the potential risks of a drug. So there are a couple ways that we replace testosterone. Testosterone, you could use testosterone gel. There are men who prefer the gel. There's also testosterone pellets, where you might have a pellet placed every 3 months. We can also use testosterone injections, and the injections could be given every 2 to 4 weeks. And I'll go over what the difference is between these options. So your normal testosterone production, like if you have a normal testosterone level, you're in your 20s, your testosterone is 700, that's good. Testosterone is made in a circadian rhythm. What that means is that it's highest during some times of the day and lower during others. And for testosterone, like a lot of other hormones, it's highest in the morning. So if you want to diagnose someone with low testosterone, you have to check their testosterone levels first thing in the morning. I usually say before 10 o'clock. And you can't go off of just one number because the levels can tend to fluctuate. So you must have 2 low numbers that confirm the low testosterone. So if someone has confirmed testosterone and they're interested in treatment, when you replace a man's testosterone, like if you give a woman hormonal replacement therapy during menopause, the man will have an improvement in their libido, an improvement in energy, improvement in mood, improvement in erectile function. So it does work. So in terms of the different preparations, the testosterone gel, there are a couple of them out there. Androgel, there is Androderm. So this is a gel that you put on your skin every single day, and it closely mimics what your own body should be making because it's a slow, steady daily release of testosterone. You got to be careful when you use the testosterone gel. Like you got to make sure you wash your hands. You obviously can't put it on and then go shower or put it on and then go swimming. You got to make sure that it's absorbed. You also have to put it on in a way that you can cover yourself with a t-shirt. Imagine that you put on testosterone gel and then go and hug your wife, right? You do that every single day. You are going to be transferring the testosterone gel to your wife, and she's going to have hair growth on your face and all of that stuff. So that's one thing with the gel. The gel is also a little bit more expensive than the injections, but a lot of men who kind of want that more steady release, they prefer the gel. I also do testosterone injections. It's a little cheaper. There's some clinics that they bring the patients in and we give them the injections, but I've been other places where the man or his partner gives them the injections. The issue with the testosterone injections is because, think about it, if I give you a shot every 2 weeks, the first day or two, your levels are going to be super high and then they're going to go down. So it's not as steady a release as the gel. But it also leads to resolution of symptoms. It's also a cheaper option for some men as well, because testosterone replacement, in my experience, is not always well covered by insurance. So that's cost is also a factor to consider. What about side effects of testosterone? I said earlier that whenever you go on any medication, you have to weigh the benefits of the drug against the potential risks of the drug. And a few side effects to mention, some men, especially if they're on too high a dose, they can have aggression, they can have acne. It's as if you're going through puberty again. So some men can have acne. In the older men, testosterone actually causes the prostate cells to grow. So in some older men, it can lead to prostate enlargement. So you can have urinary problems with your urinary stream, or you might want a urinary urge that you want to go, but nothing is coming out, or difficulty getting your stream out. So usually I ask those questions, do you have any issues with getting your urine out? Testosterone can also lead to swelling in the ankles. In terms of more major side effects, testosterone can increase the blood thickness, your blood thickness. So that puts you at risk for having clots in the legs. So as part of the monitoring, I also monitor your blood thickness. There's also been an association with testosterone replacement and heart disease. Kind of inconclusive, but before I put anyone on testosterone, I make sure that if they do have heart disease, that I get clearance from their cardiologist. And one thing that I didn't really talk about earlier, but I want to mention is obstructive sleep apnea. A lot of us have undiagnosed obstructive sleep apnea where we snore at night. Our partner might tell us that we stop breathing during our sleep and they have to nudge us to wake us up. There are different questionnaires that you can take. You can even do them by yourself. Do them at your house. If you look at one of them, is called Stop Bang, STOPBANG. Another one that I use is called the Epworth Sleepiness Scale. It gives you some scenarios like, if you're driving, if you are watching television, if you're talking to someone, what is your likelihood of falling asleep? So if you do think that you screen positive for sleep apnea, please discuss that with your doctor because you would have to be referred for a sleep study. Sleep apnea also affects the production of the hormones called LH and FSH by the pituitary gland that stimulates the testes to make testosterone. And once you fix someone's sleep apnea, their testosterone levels naturally go up. And there have been also studies that show that if someone has undiagnosed sleep apnea and I put them on testosterone, I can make the sleep apnea worse. So anyone who comes to me with low testosterone, I always perform the Epworth sleepiness scale to see if they also have coexistent sleep apnea, because that also needs to be fixed. Another side effect of testosterone treatment is infertility. Because when I give you testosterone in an injection, I shut down your body, your pituitary's hormones. So the pituitary can't stimulate the testes to make sperm. So testosterone treatment will lead to infertility. So if you are a younger man who has issues with low testosterone for whatever reason, and you still want to have more children, then testosterone replacement or testosterone injections or the gel is not a good option for you, because it will lead to infertility. It will reduce your sperm count. There are other medicines that you can use, other hormonal therapies that you can use to raise testosterone levels while maintaining your sperm count. And I just want to end with, I'll go to the questions, but I just want to end talking about the importance of really maintaining your weight. I said this earlier and I'll say it again. When you're obese or overweight, that's a really common cause of erectile dysfunction, even if your testosterone is normal. But with a low testosterone, what we found is that if you lose some weight, you will naturally increase your testosterone level. That's another reason why we need to keep our weight down, why we need to exercise, why we need to maintain a healthy diet. So one of my blackdoctor.org viewers said, is 44 young to have a testosterone issue? So it all depends if you are a healthy 44-year-old or not. You know, if you have any of these other coexisting conditions like heart disease or diabetes or hypertension, if you're overweight or obese, or if you have sleep apnea, then no, 44 is not too young. Remember I said earlier that it's 10% by decade. So, you know, someone in their 40s, about 40% of men might have issues with testosterone. So 44 is definitely not too young. And then Michael said, how does high blood pressure medicine affect your testosterone? So high blood pressure medicines will not necessarily affect the testosterone levels per se, but they can lead to erectile dysfunction. A lot of these medicines, there's one that's called like a beta blocker, like atenolol, metoprolol. These medicines work on the vessels all over your body. They work on relaxing the vessels, and I believe that's how they can lead to erectile dysfunction. So, ladies and gentlemen, I just wanted to come on quickly to talk about testosterone and erectile dysfunction. Don't be afraid to raise it to your doctor. And doctors, don't be afraid to ask those questions. And especially if you have diabetes, that's what I do every day. If you have diabetes and you are struggling, you're having issues with getting and maintaining an erection, please bring it up to your doctor. They can check your testosterone levels. They can check you for sleep apnea. They can go over your medication list to see if they can swap something out for your beta blocker. If you are on a antidepressant, please talk about it to your psychiatrist or your primary care doctor. They can perhaps change it to something else that might have less side effects on your erectile function. For those of you who have diabetes, I wanted to share with you, I actually have a diabetes ebook. You can get it at drkellysebook.com, where I share like some tips about diet, using diet to reverse diabetes. When should you be checking your blood sugars? What should your blood sugar goals be? I'll be giving you a sample diet as well to use, talking about counting carbs, using minerals like, magnesium, just having an overall healthy diet and how that helps with lowering your blood sugars. Diabetes affects all of the vessels in your body. In addition to affecting the vessels that flow to your penis, they also affect the vessels that go to your heart. Patients who have diabetes, the leading cause of death in patients who have diabetes is actually heart disease. Diabetes can also lead to plaque buildup of the vessels that go to your brain, and that leads to stroke. So, and even now with the pandemic, if you have diabetes, we should be really working hard to lowering those numbers to reduce your risk of having a severe infection or a severe complication from COVID-19. Anywho, I'm going to sign off now. Thank you all for joining. Let me see, make sure I don't have any more comments. So someone said, I have 0 testosterone, and my doctor said she wouldn't give it to me because of side effects. So I'll say it again. You always have to weigh the benefits of a medicine against the risks of a medicine. So before I put anyone on test, I forgot to mention one other side effect. Testosterone does not cause prostate cancer, but if a man already has prostate cancer, testosterone can theoretically make it more aggressive and make it spread. So there are a few cases where I will not prescribe testosterone either. And that's someone who has a history of prostate cancer. A lot of us are hesitant to do that unless it's been 5 years post-diagnosis and your PSA levels are undetectable. PSA is the test that we use as screening to see if a man potentially has prostate cancer, and we also use that as our tumor marker to make sure that the prostate cancer has been cured or has been taken care of. So the patients that I probably will not be using testosterone on will want somebody who has a history of prostate cancer or an elevated PSA level and they don't know why. Secondly, I'm not going to use testosterone on someone who has really bad heart disease because, like I said, it's been linked to worsening heart disease unless they get clearance from their cardiologist. Thirdly, I'm not going to use testosterone on a man who already has an elevation of their blood thickness because I will only make it worse. And that can put you at risk for having a clot in your leg that can go to your lungs and kill you. We don't want that, right? And then finally, I'm not going to use testosterone in a man that has sleep apnea that's not been treated. So if a man comes to me and they tell me, doc, I have sleep apnea, but I don't want to wear the mask, I say, well, unfortunately, I can't prescribe testosterone for you until you get your sleep apnea treated because I can potentially make it worse. So those are a few scenarios. I'm not sure in your case which one of those four things relates to you, but those are the 4 scenarios where I personally will not be prescribing testosterone. Dr. Renee, I appreciate you. Thank you for giving me these questions. It's another viewer from BDO says, is low sperm count a side effect of taking Viagra or similar pills? No, you're not going to have a low sperm count from taking Viagra. These medicines work by opening up the vessels that run to the penis and by boosting or helping blood flow to come to get the erection. The low sperm count is a side effect of testosterone treatment, however. So like I said, if you want to still grow your family, then testosterone injections or even the gel is not a good option. And you can go to urologists. I find that, endocrinologists, we treat men with testosterone, but I'm finding more and more urologists also doing this as well. So we have options out there. Please don't suffer in silence. Like I said, there's lots of shame and embarrassment. Men don't go around telling each other about their erectile dysfunction, but it's actually a lot more common than you think. In your 50s, 50% of men. In your 40s, 40% of men. 70% of men. So most of the men that probably have the same issue. Another question, does diabetes always cause erectile dysfunction? No, it does not. Uncontrolled diabetes can lead to erectile dysfunction. But if you can lower your blood sugars, if you can get your A1C at goal, and a goal A1C for most people is less than 7%. If you get your A1C at goal, you reduce your risk for having any of these complications. So no, having diabetes is not a death sentence. I tell my patients every single day, like, you can get off of these medicines if you make those lifestyle changes. Most early on in your diagnosis, most of the time you can get off of these medications. So having diabetes does not mean that you will have all of these complications. But if your diabetes is not under control, you might. Like I said, a good resource for you to have if you have diabetes is to go to Dr. Kelly's ebook.com, pick that up, and it will give you some tips on how to lower your blood sugars. So someone else said, I'm diagnosed with a prolactinoma. I take bromocriptine. I have low testosterone. Wow. Have sleep apnea. And I'm overweight. What type of testosterone should I take? So that's a very good question. So this individual has 4 reasons for having low testosterone. So if you came in front of me, I would personally, depending on how low the testosterone levels are, if the testosterone, and I forgot to mention this earlier, in older individuals, if your testosterone is less than 150 and it's not a problem with your testes, it's a problem with your pituitary gland, then we also have to do a pituitary MRI to look for any pituitary masses. Usually pituitary tumors are benign, meaning they're not cancerous. If you are a younger man and your number is less than 250 for your testosterone, and it's not a testicular problem, then we do an MRI. So what this person was referring to with a prolactinoma is a pituitary tumor that makes high levels of prolactin. Prolactin is a hormone that is found in both men and women. It's higher in women, especially when they're pregnant or just after pregnancy, because it helps with breast production. That's why when women have a high prolactin level, they have nipple discharge. That does not happen in men. But a high prolactin or a prolactinoma in a man will shut down the pituitary from making LH and FSH, so it can't stimulate the testes to make testosterone. So there's medications that your doctor can give you, like bromocriptine, that will lower prolactin level. What I've found is that if a man comes to me with a prolactinoma that's making high levels of prolactin, once I give them bromocriptine or cabergoline and I get their prolactin levels down to normal, testosterone usually comes up. So the low testosterone is actually just a symptom of the high prolactin. So treating the high prolactin usually resolves the low testosterone. But you also have other reasons for having low testosterone. You have sleep apnea. So is your sleep apnea treated? Are you wearing your mask most hours during the night? Have you had your mask interrogated? Are your settings right? Have you seen your sleep doctor? And then number 3 is you're overweight. Have you tried losing weight? What have you done to get some weight off? Because that will also naturally increase testosterone. So before I, throw testosterone at anyone, I try to fix the underlying issues first, because sometimes if we don't fix these underlying things, even if we give you testosterone replacement, you're not going to feel better. But in terms of what type of testosterone you should take, if your doctor decides to put you on testosterone, either the gel or the injection would work, depending on issues with cost, depending on if you want to stick yourself. So I would say try to treat these underlying issues first before going on testosterone replacement, because it does have some pretty major side effects. Another question, can a healthy man have erectile dysfunction? Yes. We talked about the impact on stress, impact on anxiety, impact that depression has on erectile dysfunction. So you might not have a physical cause for your erectile dysfunction, but you might have a psychological cause. Also, depends on how old you are. You could be a healthy 60-year-old man, but as you get older, testosterone levels do go down. That's just a part of getting older. So a healthy 70-year-old man will never have the same testosterone levels or the same erectile function as a healthy 20-year-old man. And then the last question here was, what should your A1C be to be considered good? So according to American Diabetes Association, your goal hemoglobin A1C, and the hemoglobin A1C is your 3-month average blood sugar. And if you have diabetes, that 3-month number, your A1C should be less than 7%. However, we individualize our care. What does that mean? Meaning that if you are an older individual, if you have heart disease or kidney disease, history of a stroke or heart attack, we are afraid that you might have low blood sugars and fall and hit your head, or, might have low blood sugars. We don't try to get your number under 7%. You might be happy with an 8%. So my older patients in their late 70s or 80s, my goal for them is under 8%. Someone who's in their 50s and 60s, 30s to 60s, I would say under 7%. For my really young, healthy patients, like in their 20s or even 30s, I aim for under 6.5 because I'm not as concerned for the risk of hypoglycemia or low blood sugars with those patients. So this was really good. Thank you for all your questions, for keeping the discussion going. I wanted to do this in honor of Men's Health Awareness and in honor of Father's Day tomorrow. For those of you who are fathers, we thank you. We thank you for who you are in our life and what you do for us children. Shout out to my own father, John. Thank you for being a great dad. Really appreciate you. For those of you who have diabetes, please go and get that book, Dr. Kelly's ebook.com. It's scrolling across the screen. Please like the video. Please share it. A lot of men have these struggles, but we don't talk about this. Please follow me on all social media handles at Dr. Kelly Wood, MD. I do different talks of surrounding diabetes and other hormonal issues. I'm also a bounce back coach. I help high performing women overcome past hurt to have a happy and healthy relationship. And I am passionate about these two things. So some weeks you might see me talk about medicine. Another week you might see me talking about relationships. But all of it is to help you guys to lead a healthy and happy life, mind, body, and soul. Thank you for joining. I'll see you guys next week. Bye-bye.